Hi, I'm Dr. Pasquale from NSI. One of the most common conditions we see is chronic obstructive pulmonary disease, or COPD. Most common cause of COPD, unfortunately, is smoking, so we see quite a bit of it. What COPD represents, and it doesn't matter if it's chronic bronchitis, if it's emphysema, if it's interstitial pleuritis, if it's pulmonary fibrosis, those are just subsets of a blanket term, which is COPD. At the end of the day, COPD means you can't oxygenate your blood, you can't breathe as a result of damaged lung tissue. And really the take-home message is that it's damaged lung tissue. So when we talk about the standard of care and the limitations associated with the standard of care, it's this. The symptoms that we experience as a result of damaged tissue, medication is pretty decent at dealing with those symptoms, but it can never stop the progression of the disease, and it can never help patients overcome that disease because it never really takes care of the problem. In this environment, what we've been able to do with stem cell therapy is nothing short of remarkable, especially for COPD. Remember that our lung tissue is made up of primarily cartilage as well as connective tissue, and that tissue doesn't have the capacity to heal on its own. So what we do is we force it to heal using the cells that exist in your body, the stem cells that exist in your peripheral tissues. We take those stem cells in abundance, we inject them intravenously so that we can get them to the lung tissue, but then we also have patients nebulize a product called PRP, which contains platelets and growth factors and the things like necessary for healing to occur. What we liken it to is fertilizer. Right? So stem cells are seeds to regrow tissue. PRP is fertilizer. But what it does, and what's most important, I think this is what makes us special, is it helps us to direct stem cells to patients' lungs. Yes, the first pass is going to be through heart and lungs, but when we nebulize PRP, it allows us then to have a greater effect in that lung tissue and ultimately promote a better outcome. What I typically tell COPD patients is, look, obviously lungs are really big tissues, really large, and in many cases we see lots of damage. If it's early stage, many times it's really just one dose. But if it's mid to late stage, the chances that will require more than one dose are probably pretty high. But when it comes to COPD, unlike other conditions, there are no other choices. And the end stage of that disease just isn't pretty, and most of the patients that come to see us are really focused on preventing that, and I think that's a good thing because we've been able to help quite a few people.